Hello, my name is Kian, and today I'm presenting on precision communication, tailoring physicians' communication to patients' health literacy. So, a little bit about me. I'm a rising senior at the Nueva School in San Mateo, California, in the United States. I'm interested in the social determinants of health and how they contribute to the broader concept of patient-centered care, where power and agency are put into the hands of patients themselves. I'm involved in research into multi-omics approaches and the gut-brain axis in Parkinson's disease. I volunteer at an elderly care unit in a local safety net hospital, and I've developed research education programs and mentored at a preclinical immersion program for high school and college students. I've spearheaded projects in health tech, one of which I'll share with you today, and I enjoy working to address the Sustainable Development Goals, as well as attending and sharing Model United Nations conferences. So let's jump right in with this statement that equitable healthcare goes beyond just biology. What do I mean by that? Well, social determinants of health are the non-medical factors that influence health outcomes, including the conditions where people are born, grow, work, live, and age. Social determinants of health significantly impact health inequities around the world, with lower socioeconomic status generally correlating with poorer health. And research actually shows that social determinants of health can be more important than health care and lifestyle choices in influencing health and account for between 30 to 55% of health outcomes. Communication is the foundation of a strong physician-patient relationship. Two central communication roles of physicians are to achieve shared understanding and encourage shared decision-making with patients. Traditionally, healthcare in many countries is organized primarily from the physician's perspective. And because they're so pressed for time and caring for many patients at once, physicians don't put enough weight on the social context of individual patients. Because of this, vulnerable populations, such as patients who are elderly, racial or ethnic minorities, economically disadvantaged, or uninsured or underinsured, typically experience a lower quality of care, deriving from poorer communication with their physicians. Providing patient-centered care, where patients actually work with their physicians as partners to optimize their health, is a critical step towards resolving health disparities and improving the health outcomes of these communities. Health literacy is defined as an individual's ability to find, understand, and use information and services to inform health-related outcomes. Limited health literacy actually impedes shared understanding and shared decision-making between patients and physicians. So physicians commonly use simpler language when communicating with their physicians. This is called universal precautions. But recent research indicates that a universal tailoring approach is actually more effective, where physicians adapt their language to their patient's health literacy. In this table, the odds ratio shows that the odds of having the outcome of poor understanding either increases if it's above 1 or decreases if it's below 1. So you can see that universal tailoring improves shared understanding while precautions does not. And as a bridge to my work, I wanted to share a statement from the World Health Organization. The rapid expansion in access to new communications technology and use of social media offer new platforms for health literacy efforts, such as through mobile for health or mHealth technologies. And so Perch is an application that I founded about 2 years ago now and led the development of to combat the communication gap. In essence, patients first fill out a brief questionnaire composed of 3 published health literacy screeners across written, verbal, numerical, and digital communication domains. Once the patients complete the screener, they identify their most pertinent communication needs and rank them in importance, in order of importance. For each need they select, patients indicate a strategy from a list of options that they'd like their physician to prioritize. The application generates a concise report for the physician containing a health literacy assessment, the patient's needs, and personalized communication strategies, which are curated from reputable sources such as the Agency for Healthcare Research and Quality. The report can be exported as a PDF, so it's versatile for different settings and is designed to be feasible in a physician's workflow. And finally, Perch not only empowers patients, but promotes empathy in the physician-patient relationship, both by encouraging feedback cycles and seeking newfound understandings. So we conducted beta testing. We gave participants a questionnaire consisting of validated patient trust and self-efficacy scales completed both before and after they tested the app. Of course, we kept in mind safety considerations, things like providing consent, anonymizing patients' responses, and not saving the data they entered in our app. On average, all participants had limited health literacy in at least one communication domain. What we found was that Perch increased self-reported trust and self-efficacy across the board. In the graphs on the right, the dark blue line is patients' responses after using our app, and the light blue line is their responses before using the app. The left side of the x-axis is the positive end of the scale, and you can see that in all three graphs, after using the app, patients' responses shifted more towards the positive end of the spectrum. What does this mean? Well, essentially, Perch is mitigating the downstream effects of limited health literacy on quality of care, with the ultimate goal of empowering vulnerable populations to reduce health disparities. My secondary goal with this project was to use my work to raise awareness about health communication and disparities. And over the past 2 years, I've shared my research at multiple STEM fairs, pitched and presented at 10 events, and worked with a law firm to develop Perch using an approach of incorporating privacy into the app during the design process, known as privacy by design. I've been so grateful to be able to work with and raise awareness through many organizations. And Perch has been recognized by the MetLife Foundation and Network for Teaching Entrepreneurship as one of the top 10 innovations in 2022, advancing the UN Sustainable Development Goal number 3, good health and well-being. So to summarize, I want to focus on 3 key points, which were the titles of the first 3 slides. Equitable healthcare goes beyond just biology and into the social determinants of health. Communication is the foundation of a strong patient-physician relationship and requires an understanding of the social context behind each individual. Health literacy is a large issue, impairing shared understanding and decision-making, and our healthcare systems need to move toward a universal tailoring approach. I want to close by sharing 3 lessons I've learned from this journey in a TEDx talk I gave this past April. I call these the 3 C's of caring. First, tailor your communication to the other person's needs. Remind them of the little things that bring them comfort, and consider them within their holistic context. Thanks to my teammates Teddy, Cheyenne, and Aideen, as well as our mentor Morgan Snyder, for their help and support throughout this project. Thanks for listening.